All right, so let's go through some of the real basic surgical instruments that you guys are always asking about. This is actually a hand tray that we have here, so I'm going to go through some of the instruments in the hand tray. So let's just start at one end. All right, so this is your towel clip. A towel clip, if you notice, has these two pointed ends that actually crisscross. Okay, they actually don't meet in the middle, they cross in the middle. It's a little bit different than some of the bone forceps, which actually, this one was just used, bone forceps that you can see actually don't meet in the middle because they're supposed to be, there's a bone that's going to catch in the middle. So towel clip is used to sort of, when you're draping, you can pull two ends of the towel together. All right, so towel clip. So now we're going to go through some of the smaller hemostatic forceps. Okay. So this is just a straight small hemostatic forceps. All right, and then you have the small curved hemostatic forceps. So a little bit different, but you can kind of just get a sense in my hand how big it is, also known as a mosquito. All right, and then you have one of the, you can just keep it on here, so you don't have to go back and forth. So this is a regular curved hemostatic forceps. Okay, you can see it's just a little bit bigger than the mosquito. So another one right here. So now you have, if you notice, those are a little bit different than this. This is a bit of a right angle forceps. Okay, so you can see comes literally to a right angled point. Okay, so these come in different sizes, but the right angle forceps is used for dissection purposes, sometimes for clamping a vessel. This is an Alice clamp. Okay, so you can see this has got sort of these teeth that come together, but it's not particularly sharp. And this can be used to grasp potentially a fascial edge, like this, maybe. It's meant to sort of grasp tissues, hopefully without tearing them too much. And you can compare that to this, which is a Coker clamp. So Coker clamp is a clamp that's got these sort of teeth on the end of it, okay? And they come to a point and actually cross each other up a little bit. So this can be also used to grasp like a fascial edge. It's a little bit, it's going to get a bit of a tighter grip than the Alice forceps because the point actually crosses the other two points like that. So Coker clamp. Okay. Here you have something that looks like a hemostatic forceps, a little different, a lot more blunt. Okay, this is actually just a needle driver. All right, so I'm going to clear some of these instruments out now. All right, so this is a needle driver. Some of them have a gold handle, some don't. But essentially, it's meant to hold a needle inside this end. Okay. Now we got some of our scissors here. So here you have sort of a long, narrow scissor. This is got a curved tip. This is a Metzenbaum scissor. Okay. Here we also have some of the smaller scissors, which are, this is a tenotomy forceps. So it's got sort of a sharp end. It's very small. It's good for dissection and for tenotomy. And then you have the iris forceps, which kind of have these big, long, or big round handles and a small cutting tip. Okay, this is another iris. Okay, so those are some of the scissors. Scissor, do you have a nail scissor? It's a regular bandage forceps, something that you'll see when you're cutting dressings off. Use it to cut sheets off. So a large black handled bandage forceps. This is a Mayo, okay, or a straight Mayo scissor. This is good for cutting fascia. It can also be used to cut sutures. You can notice it's a lot thicker and looks a little bit different. It's heavier than the Metzenbaum. All right, so those are the scissors. So let's go through some of the other bone-related instruments now. Or actually, you know what? Maybe we'll go through a few of the retractors first. So this is a Sen retractor. Okay, it's you can find it in a lot of the small instrument and hand sets. It's got a sort of angled retractor on one end, and on the other end it has these teeth, and they can be blunt or they can be sharp. So this is one that's a blunt Sen, and then this one is sharp. So the sharp obviously is maybe something if you trust the tissues are safe that you can sink your teeth into it with the forceps, then that may control things better. Whereas if you're near some vessels or nerves and something you don't want to dig into, you can use a blunt one. In the handset, you may also have some self-retaining forceps. So here you have what's called a Gelpi. Okay, this has got two pointed ends. Again, if you feel safe where those two pointed ends are going, it can be a relatively atraumatic forceps. A little bit different than the self-retaining wheat lantern. Okay, so this is the wheat lantern forceps. These can be blunt or sharp. Okay, so this is also a self-retaining forceps, lots of teeth. Okay, and here is a sharp version of that. Okay, so you can see a little bit different. One is blunt, one is sharp, similar to the Sen, where you kind of have the blunt and sharp one. Okay. So those are some of the self-retaining retractors. So now we can get to some of the sort of bone instruments. All right. So this is going to be a small curette. These are real small because it's coming out of a handset, but these are curettes. Curettes they're sort of like a spoon. Okay. So they're used to sort of maybe scoop bone out of a cavity, cancellous bone perhaps, or to maybe elevate scar tissue off of bone. But those are some small curettes. Here you have what's called a rongeur. All right, so this is a small rongeur, or maybe it's a synovial rongeur. It's something that you'll see in a handset like this. This is used to sort of grasp and pull at tissue. It may be used to sort of clean out a fracture site, for instance. Okay. Then we have some of the bone cutting instruments. All right, this is actually a bone cutter. All right, it looks a little bit like a pair of pliers or a wire cutter. Okay, so these are a few of the different instruments that all sort of cut things. So that's a wire cutter, and this is also kind of like a plier, and then this is the bone forceps. Bone cutter. The bone cutter is a little bit longer, slender, and most of them have this sort of double action at the end there, so for cutting bone. And just a couple of other things, retractors, since I think med students need to know all about retractors, since you're going to be retracting a lot. In the handsets, you're also going to have these skin hooks, right? So this is like a single skin hook here, and then you can have a double. Whoops, that's not one. Let me get a complete one. You can have a double skin hook here. Okay, so these are used to retract skin edges. They come in different sizes. There's a very large skin hook you see there. There's also if I can dig it out of here, a much smaller skin hook, maybe even smaller than you can see. But these are handheld retractors used to retract the skin. And I think for the handset, that pretty much handles most of it. Actually, let me go through just a couple of other things. Maybe that would be helpful to know. A couple of other bone instruments. So here are some of them. These are osteotomes. As you can see, this was just used. This is an osteotome. This kind of comes to a sharp point. It's beveled. So this is meant to cut bone. So you would place it. You would then take a mallet, for instance, and then you would sort of tap on the end of this, and this is going to cut bone. And these come in different sizes. Some of them are curved. These are two small straight osteotomes. And then sometimes you can have a sort of bone tamp, something like this, which is literally just like a stick. And this can be used to, like in the case we did, we had to just put bone into a space, and then we put this on top of it, and then we tap this to just literally push something small so you're not using your fingers, for instance. Okay, and here's one of the mallets that you may find in a handset. So you would potentially bone tamp, your bone into place. Let's see, a couple of other things actually probably are worth mentioning. Keep thinking we're done, but there's actually lots of stuff here. Because you will see these also. This is a key elevator or bone elevator. So bone elevators are used to sort of elevate periosteum off of and muscle off of bone. So they may be used kind of like this. The Cobb elevator is a similar instrument you may see elsewhere. This is called a Freer elevator. So it's a thin handheld, and it has this sort of two curved ends, and similarly is going to be used to elevate tissue off of bone. Okay, Freer elevator. And a couple of other retractors that you should be aware of. I can assure you a lot of these get used. So here's an Army Navy, so each two of them. So you see there's like a short end and a long end. Okay, and these are used to retract in larger wounds. Another retractor is the Homan retractor. So you can see this is curved. You can imagine if this was the bone, for instance, that you could retract soft tissue by placing the curved end here and then leaning back this way. And this would sort of, if this was all soft tissue, this would sort of help to retract the soft tissue out of the way, but it sits up against the bone like this, right? Or it could be placed this way and retract that way, okay? So, all right, I think that does cover quite a bit for some of the small retractors and instruments for an orthopedic case. Thanks.